My name is Dr. Emily Carson, and I'm a urologist practicing in Chicago. I've worked in this field for nearly 12 years. In all that time, I thought I had seen it all. Embarrassed teenagers, middle-aged men trying to avoid surgery, even anxious athletes afraid of compromising their performance. But nothing quite prepared me for the patient who would change my perspective on not just my profession, but also the human side of medicine. His name was Michael Warren, a 36-year-old IT technician who walked into my clinic one late Monday afternoon looking visibly uncomfortable. His chart said he'd been referred by his general practitioner for persistent lower abdominal discomfort and urination issues. Fairly standard. But what wasn't standard was the way he carried himself. Tense, shoulders tight, and barely able to meet my eyes when I walked into the room. "Good afternoon, Michael," I said with a warm smile, closing the door behind me. "I'm Dr. Carson. Let's see how I can help you today." He nodded, eyes flicking down to the clipboard in my hand. "Thanks for seeing me. I'm not great at this. Most patients aren't. Urology isn't a topic people casually talk about over dinner, and I've long accepted that the stigma surrounding it often causes more harm than the conditions themselves. So I took my time, speaking softly, asking questions gently, and giving him room to feel in control. After a few minutes of discussion, I gathered enough context. He had been dealing with increasing pain, frequent urges to urinate, and most concerningly, blood in his urine. He hadn't told anyone, not even his partner, because he was afraid. I reassured him, told him we'd run a few non-invasive tests first, and made sure to explain everything step by step. He nodded along, clearly appreciative of the detail. The first set of labs and imaging didn't take long, and 2 days later, he was back in my office. I could tell by the way he sat, less stiff this time, that he was starting to trust me. "So," I began gently, pulling up his scans. "The good news is, it's not cancer. But there's a stone in your left ureter causing the discomfort. It's small, but it's lodged in a way that isn't passing naturally. We have a few options." I walked him through the procedures: shockwave therapy, ureteroscopy, and a possible stent. He was quiet for a while, his hands clenched together. "Will it hurt?" he finally asked. I paused. "There might be some discomfort, yes. But we'll do everything to manage your pain and keep you comfortable throughout the process." "Even the stent thing?" he asked with a nervous laugh. I smiled. "Even that?" He laughed, finally meeting my eyes. That was the first time I saw the person behind the fear. And for some reason, I felt a responsibility to go above and beyond. Not because of the case complexity, but because I knew how vulnerable he felt. We scheduled him for a minor procedure later that week. I made sure to assign one of the most empathetic nurses on staff to his pre-op prep, and even checked in on him personally right before anesthesia. "You good?" I asked, standing by his bedside in the surgical bay. "As good as a man can be in a hospital gown," he joked, his voice only slightly trembling. "We've got you. You're going to be fine," I said, squeezing his shoulder gently. The surgery was smooth. The stone was removed without complications, and he woke up groggy but relieved. I visited him in recovery, going over aftercare instructions, sitting beside his bed longer than I usually would with patients. He asked about the recovery process, how soon he could return to work, and if the discomfort would last. I answered all his questions, and then some. Over the following weeks, he came in for follow-ups, and each time, our conversations drifted a little beyond medicine. He told me about his love for vintage video games, his struggle with a past medical phobia, and how this experience, while nerve-wracking, had restored a bit of his confidence in the system. One afternoon, at his final checkup, he brought in a small gift. A mug that read, "Urologists have the toughest job hands down." We both laughed. "You didn't have to get me anything," I said. He shrugged. "You made something terrifying feel manageable. That matters." I didn't have a clever reply, just a smile and a nod. "Because that's why we do it." Behind the degrees and procedures and long hours is the quiet privilege of guiding someone through their fear, making them feel safe when they're at their most vulnerable. But the story didn't quite end there. A few months later, he showed up at my office again, this time not as a patient. I was surprised to see him in the waiting room, holding a small folder. "I hope it's okay that I stopped by," he said. "Of course. What's going on?" He handed me the folder. It was a printed set of blog entries titled, "Fear and Peeing, A Guy's Urology Journey." "I'm publishing them online," he said, "as a way to help others." "You inspired that." I sat down, touched. In his words, I saw the real impact of what we do, not just treating conditions but treating people. Months passed, and the blog gained traction. Michael was now writing regularly, advocating for men's health, sharing tips, debunking myths, and encouraging men to stop delaying appointments out of embarrassment. He even quoted things I had told him: "Be kind to your body, and fear grows where silence lives." We stayed in touch professionally. He even invited me to speak at a small panel he organized on men's health awareness. It was surreal, seeing a once anxious patient now standing on a stage with confidence, thanking me publicly for making him comfortable in every way that mattered. It made me reflect on how important it is not just to treat symptoms, but to connect, to listen, to reassure. Because often, healing starts before the procedure. It starts the moment someone knows they're not alone. So yes, I'm a urologist. But I'm also someone who believes that comfort is part of care. And with Michael, I did everything I could to make sure he never felt like just another case. And in return, he reminded me why I chose this field in the first place.